is Dr. Jonathan Lustgarten. I'm a board-certified neurosurgeon and spine surgeon practicing in Monmouth and Ocean County as part of Neurosurgeons of New Jersey and was the founding partner of this portion of our practice here in central New Jersey. It's an interesting story regarding the recovery from lumbar fusion surgery because in the 25 years or more that I've been practicing, really no field of neurosurgery has evolved, changed, maybe even you could say revolutionized as much as these types of procedures. In years past, when patients were told they needed a back fusion, this was a cause for great dread and quite honestly in some cases appropriately so. When I was a training neurosurgeon in the 1980s, to do these surgeries we would have to basically make a big cut right down the middle of the patient over an extensive area and strip the muscles and spread the muscles off of the spine and expose the spine widely in order to do these types of surgeries. In the time since I've been practicing, this has completely changed, and I'm actually proud to mention that I think one of the things I'm most proud of about the way our practice has evolved here at Monmouth County and in association with Neurosurgeons of New Jersey, that we have really been on the cutting edge and leaders in the area of minimally invasive spinal surgery. We had the first OArm CT Scanner in New Jersey, which is the most widely used now device to help surgeons basically use computers and intraoperative images acquired through an intraoperative CAT scanner to navigate in a patient's spine, and this allows us to be much more targeted, much more direct and precise, and much less invasive. And as such, we're able to basically do much better surgeries in a way that allows patients to recover much more quickly, and the outcomes have just dramatically changed. If I may, I'll give you an example of how this would work. If you wanted to do a fusion, for example, between lumbar 4 and 5 open, you might cut the patient from L1 down to the sacrum to strip the muscles off the patient's spine and expose that in the old school way that was the case back in the day. With computers and navigation, we can actually do this surgery now through much smaller incisions. So typically, you can actually appreciate if you look at this model, these screws go in at an oblique angle into the spine. To achieve that open, you need to have an incision that's widely open. Now we make a small incision off here and use computers and navigation to place screws in the structures that they need to be in to stabilize your spine. Basically 100% accuracy, greatly minimizing the risk of inadvertent screw placement or complications from hardware, and allowing us to do these surgeries through little tiny openings, through little tubes, and basically leave all these muscles that sit along your spine where they were meant to be and undamaged, unscarred, etc. I have found that patients recover dramatically better with these types of technologies than they did when I started my career, and it's been an extremely gratifying part of my practice as a clinician. I've had patients go back to all sorts of activity. I had a rather well-known folk musician who was a patient of mine who played a concert 9 days after a back fusion surgery like this. Patients who've resumed running their businesses, being physically active within a few weeks to a month or so of surgery. And I think generally patients can expect to be at full and unrestricted activity within 2 to 3 months of these types of surgeries.